Hi, my name is Erik Vanderlip, and I'm the Member in Training Trustee on the Board of Trustees. I'm a PGY7 at the University of Washington in Seattle, where I'm studying health services research in a health services research fellowship. The APA has been really integral in helping the profession of psychiatry advance integrated care. And by integrated care, we're talking about the combination of behavioral health and primary care, or other facets of medicine. Up at the University of Washington, there are several thought leaders who have given us new models of integrated care called collaborative care. Dr. Unitzer, Dr. Caton have shown us some of the ways that psychiatrists can continue to work in evolving models of healthcare service delivery, like the medical home that primary care is latching on to across the country. These new models offer psychiatrists new opportunities to be at the forefront of medicine and help patients with behavioral health disorders manage their illnesses better and recover in a patient-centered way that's unlike anything we've ever done before in medicine. It's exciting. And one of the challenges with integrated care and collaborative care is understanding how we can take models of service delivery that are traditionally in primary care and move them into community mental health settings. We know from years of research that persons with severe and persistent mental illness die on average 13 to 25 years earlier than age-matched counterparts. What does that mean? It means that somebody with schizophrenia in the US has an average life expectancy that's similar to those persons in Uganda. And that's quite a stark revelation. It's a new health disparity that's coming to the forefront of our knowledge. What we need is better primary care services and access to patients with severe and persistent mental illness, who are oftentimes in the community mental health settings where they get the majority of their access to care. How can we take what we know that's best from the medical home concept in primary care and put it in these community settings is something we at the University of Washington and the APA is very interested in doing. One of the things that the APA has done over the past couple of years is provide psychiatrists with additional training in the major health determinants that cause people with schizophrenia and bipolar illness to die sooner than the rest of the population. Those major morbidities have to do with ischemic heart disease, and that's heart attacks and strokes. The leading risk factors for heart attacks and strokes that we can modify are things like diabetes, obesity, smoking, cholesterol, and high blood pressure. The APA has given psychiatrists sessions at the annual meeting and workshops, symposia, so that psychiatrists can be more informed about how they can monitor those health needs in their patients at greatest risk. And at times, even extend their scope of practice if they feel comfortable in doing so to manage those illnesses. Lori Rainey and I have been working hard to create really cutting-edge workshops for psychiatrists to learn those skills for patients that may not have good access to primary care services, or at least be knowledgeable about those disorders and chronic illnesses so that they can reduce their patients' risk of heart attack and stroke. And I'm proud to be part of that as part of the APA. It's a real privilege to be part of the APA in general. I think we have a lot of hope in terms of psychiatry as a profession.